Good morning, everyone, and welcome to the Maine State Chamber of Commerce's 2021 Healthcare Forum. We've been doing this for a few years now, and we've explored a variety of different subjects, but I think this past year has given us a lot to talk about, given the impact of the pandemic on us as a state, as a society, our economy, but also our healthcare system and what that has meant to both providers, healthcare insurers, and the folks that purchase healthcare insurance. In our case, it would be businesses, large businesses and small businesses. And so we're going to talk about that with a panel of folks this morning that we're extremely pleased to have. And we hope you'll enjoy our presentation. For starters, though, we need to do some thank you for our sponsors. Our premier sponsor today is Harvard Pilgrim Healthcare. Our principal sponsor is Anthem. We have two break sponsors, Central Maine Healthcare and Cross Insurance. Our program sponsor is Maine Health, and we have supporting sponsors as AmeriHealth, Maine Primary Care Association, Martins Point Healthcare, Northern Light Health, and the University of New England. Before we get going, we have a quick few words on behalf of Harvard Pilgrim. So, Angie.
Opponents. I've met my share of them.
I've gone up against thousands.
And if you want to beat them, you can't just sit on the sidelines.
You need to do what it takes to come out on top.
This virus is the opponent we're all up against.
But there's a way to beat it. Get vaccinated.
It's effective and can protect you and the people you care about.
So when it's your turn, roll up your sleeves and let's get to the finish line. Together.
And I want to thank Harvard Pilgrim for their premier sponsorship support this morning, again. Next, what I'm going to do is go through a little bit of process and then introduce all of our speakers at once. As you probably noticed, you folks are all muted this morning, but you do have the ability to enter questions or comments into the chat box. And we've talked about it as a group and the presenters with the presenters this morning, and each person is going to go through their presentation. But if during that presentation you hear something and you have a question that you think you want to ask right away, go ahead and do that. You can also hold your questions for the end, but this forum is meant to be interactive, and so we hope you will put questions into the chat box, and I'll loop back and ask them as we go along. So with that, I'm going to begin with the introduction of our speakers this morning. Bill Whitmore is the Vice President of the Maine market for Harvard Pilgrim Healthcare. They are a nonprofit health services company providing health benefit plans, programs, and services to more than 3 million customers in New England and beyond. In this role, Bill is responsible for the strategic and operational aspects of the company across the state of Maine. He is a Maine native and a resident of Falmouth. He is a 30-year veteran of the health insurance industry, and prior to joining Harvard Pilgrim in the spring of 2019, Bill held leadership roles in actuarial, underwriting, and sales departments. He grew up in Ellsworth and is a graduate of Bowdoin College. Our next speaker will be Superintendent Eric Chapa. He is the superintendent of the Maine Bureau of Insurance, one of 5 agencies within the Department of Professional Financial Regulation. He joined the Bureau in 1989 as a statistician and then served as supervisor of the workers' comp section, where I first got to know Eric. Prior to becoming the deputy superintendent in 1998, he was unanimously confirmed as a superintendent in September of 2011 and again in January of 2017. He serves a 5-year term, and he has also been the past president of the National Association of Insurance Commissioners. Our next speaker will be Katie Fullen Harris. Katie serves as the Chief Government Affairs Officer for Maine's largest healthcare system, Maine Health. In that role, Katie leads the system's efforts to shape and respond to public policy at the local and state and national levels. Prior to joining Maine Health, Katie was the Director of Government Relations for Anthem Blue Cross and Blue Shield in Maine. She is a native of Maine, and she has an MS in Healthcare Policy and Management from the University of Southern Maine and a BA from Columbia University. She is an active runner, equestrian, and outdoor enthusiast. Lastly, Eric German is the president of Cross Benefit Solutions. Eric has worked in the employees benefit industry for 28 years, having held several positions at Anthem Blue Cross and Blue Shield prior to moving to Cross 6 years ago. He has worked on all aspects of the health insurance market, from individual and small group coverage to national accounts, unions, and associations. He is a board member here at the Maine State Chamber of Commerce, as is Bill, and the Kennebec Valley Chamber of Commerce. So with that, we're going to begin with a presentation from Bill. And Bill, take it away, and thank you.
Great, thanks, Peter. Good morning, everybody. First, I want to thank the Chamber for showing that commercial, which many of you have probably already seen over the past month or so. I also want to thank Joan and Dewan for filming that commercial, and congratulate Dewan too, who's probably not on here, but I'm sure you all saw that we now have the Maine Celtics in Maine, not the Maine Red Claws anymore. And along, that commercial obviously promotes vaccinations. There's lots of dialogue now around who's vaccinated, who's not, what you can do, what you can't do. For those of you who haven't yet, I encourage you to continue to read, to listen, to talk to friends, to talk to physicians, talk to others. Encourage you to continue to consider getting the vaccination at some point in the future. So thanks for joining us. Zoom, I know we were talking before we came on the air about Zoom fatigue. I'll try to be relatively brief. We all spend most of our days on video these days. So I heard somebody the other day say we're all becoming Zoomies. So I'm going to talk a little bit about about COVID in the past year. The panelists, the fellow panelists today, it's actually a great lineup when I think about how Maine faced up against the pandemic. And so I'm going to actually bring in each of the panelists here, and didn't have to think about this a whole heck of a lot. And I'll start with the Superintendent of Insurance, Eric Chapa. I remember very, very well last spring when he convened all the insurance carriers in the state and requested, had a conversation with us, and really, it ended up being a requirement, but was really requesting us to defer premiums for our customers, employers and individuals who were having trouble immediately. As we know, so many things shut down, completely shut down back last March and April. So no revenue was coming in for people, hard to pay their insurance premiums. So for a couple months, the insurers did defer premium payments. And I remember well, I've said it many times in other presentations, the superintendent's line to all of us was, the worst case scenario is to lose your health insurance during a pandemic. And I think that carried us a lot of us through that. And so we appreciate the superintendent and his team and everybody else in Augusta, their leadership in helping to get through those first few months and the next year. Next step in that process would be Eric German, Cross, and all of their colleagues in the broker industry. They worked tirelessly communicating between carriers and their clients, which are customers, their clients, to make sure that if they could pay their bill, they paid their bill. If they couldn't pay the bill, they understood they could defer it. And once they had deferred it, helping them to make those payments, and working with us for in some cases to defer even further out and make premium payment plans. Without the broker industry working so hard with their clients, I don't think it would have gone as well as it did. And ultimately, very few people lost their insurance during those months. And we went into that, we thought it would be a huge fall off, and it wasn't. And so we're appreciative of the effort of Eric and the rest of his colleagues in the industry. And last, I mean, you can't talk about this without talking about the healthcare delivery system, and Katie Rarely here representing Maine Health, but representing the entire healthcare delivery system in Maine. The world was turned upside down immediately. Hospitals emptied out across the state to prepare for the surge of COVID patients, which really didn't come for a while. So we were sitting with empty hospitals for quite some time. And then it did come, and many of those hospitals were full. Some, within the last few weeks were full as well. And things have gotten better over the past few weeks. But physicians' offices closed down, emptied out, and they flipped to very quickly building capabilities to deliver telehealth services, which we'll talk about a little more in a couple minutes. And then, the entire, system of doctors and nurses and everybody in the system putting themselves at risk every day to deliver healthcare. And then finally, over the past few months, the entire healthcare industry in Maine stepped up to deliver vaccines. So all they did for a year, and then, you take Scarborough Downs, you take the Expo, you take, I believe the Cross Insurance Center in Bangor, all these, the old Wex building, all these different facilities, like the old Auburn Mall, right, to deliver vaccines. And that was almost all through the healthcare industry. So we appreciate that as well. So all the panelists here, I think it's great today. And ultimately, the combined result was just about everybody who had insurance going into the pandemic kept it when they really needed it, and those that needed the care, including me, who I had COVID last October, and spent 3 or 4 hours on a Saturday night in an emergency room at Maine Medical Center. So when some people needed care, they got their care. Obviously, we did lose people, and even more people were sick. But overall, I think the state did a tremendous job to find its way through the past 14 months. We're not done yet, but I think we're in a great position, and in a lot better position than a lot of states in the country, and a lot of other countries in the world. Shift gears a little bit to talk for a couple minutes about at Harvard Pilgrim what we've seen happen. And if a lot of people talk about looking for silver linings of the past 14 months, I think that's what we do when things go well. We try to find positive aspects. When things don't go well, find positive aspects within it. One of those things is telehealth. And I'm sure you've heard about this, the surge. All health insurance carriers for years have had vendors they work with to offer telehealth services. The utilization of those services has been, I'll say, fractional, just a couple percent of total services at best. When local providers built the capability to do this, all the physician organizations, the physicians that are part of the healthcare systems, and closed their offices, people started using it. And we saw about 2/3 of physician visits back last spring, a little more than 2/3 were occurring through telehealth. So people still were able to get the healthcare they needed, or at least most of it, through telehealth. We've seen those services drop off, and it's down probably now to about 25%, and it's probably appropriately so. But what we haven't seen a drop off in is the behavioral health services that are delivered through telehealth. And I know, Katie might speak to this a little bit. Katie's passionate about our behavioral health in this state and the delivery of that care. About 75 to 80% of our behavioral health services are still being delivered through telehealth. So it's created an enormous additional access to that particular level of care that people need. And we expect that to hold into the future. And we actually saw a study the other day that said a lot of people are doing these, having these services delivered, meeting with their therapist in their cars. And I think one of those things is there unfortunately is still a stigma around it, and people don't want others to know or hear when they're talking to a therapist. So that's been, I would say, maybe the biggest silver lining of the past 14 months. A couple other little things. There was a huge drop off in emergency room services, as you might have expected last spring. Nobody wanted to go near a hospital. A lot of the emergency room services that are incurred don't need to be at the emergency room. And while we've seen a resurgence, we haven't seen it all come all the way back to the level that it was previously. So we're hopeful that people will find other avenues which are appropriate rather than go to the emergency room continuing into the future. And just another, just a small tidbit is knee replacements. Last year, we saw a pretty big shift of knee replacements from inpatient to outpatient. And that while it hasn't stayed completely at that proportion that it shifted to, a lot of them have remained outpatient. And it's frankly, it's a lot less expensive to get your knee replaced on an outpatient basis, if appropriate, than inpatient. And I guess I'd say for those of you who are watching, who are maybe manage a health plan for your company or something like that, a word of warning that there's been a talk since last year when, for 2 months, services really dropped off pretty dramatically, were postponed, canceled, rescheduled. We've been waiting for that that resurgence of those missed services, and it appears to be here. The last couple of months, a elective surgeries have been up pretty dramatically. I spoke with a CEO at a pretty large surgical practice a couple of weeks ago. They're booking their surgeons 7 days a week right now. So and still people I'm hearing can't get their surgeries for several months, scheduled for several months. So it appears that a lot of the care that wasn't delivered last year is being delivered now. We also saw a drop off in vaccinations last summer, which was startling and frightening to us, down to almost zero for a couple months in the late spring, early summer. I'm happy to say that those have returned. Our medical directors told us, delaying a vaccination, particularly for children for a few months, was not a horrible thing, so long as they caught up. I'm happy to say that most of them caught up. And we also saw cancer screenings drop off very, very dramatically last year, which was a concern. And I think just delaying the screenings has been a problem for some people. But for the most part, we've seen those return to normal as well. I think colonoscopies are the last ones to seem to be catching up, and that just could be a capacity issue. And Maine just doesn't have the capacity to deliver all those particular services. So from that perspective, the screenings from a healthcare, of the health of our population, getting those screenings back to normal has been very, very important. So I think I'll close with a couple things. Maybe the last thing, we all saw the importance over the past year of having a good healthcare system. I've always believed that we had a really good healthcare system in Maine previously. This only assured me of that over the past year. It's really, really important, and it was there when we needed it. And frankly, we have a pretty good insurance system in the state as well. And the importance of having good insurance was clearly borne out. Whether you get it through your employer, whether you buy it yourself, or you have it through Medicare or Medicaid. And there's a couple of things I think the superintendent will talk about, which have helped the level of insured in the state. We've had an open enrollment period in the individual market, like a special open enrollment period. We've seen continued increases in the individual market over the last few months, rather than normally it would drop off at this time of year with no open enrollment. That's good for the population. There's a soon to be implemented subsidy for small employers buying insurance, which will hold for the next 18 months, which I suspect the superintendent will talk about. So I think that's good. We're insuring as many people as we can and trying to keep them there. Healthcare is expensive, health insurance is expensive, but when we really needed it in Maine, it was there for us, and it was really important. And I think all of these things combined that I talked about together have really helped Maine get to this point and feel like right now that we're not quite out of it, but almost out of the pandemic. So that's it. Any questions later would be great, but Peter, I'm going to turn it back to you.
Thanks, Bill, and thanks for your comments. Eric, I'm going to let you take it away.
Thank you, Peter, and thank you, Bill, for the presentation. And in the beginning, I do want to, Bill talked about the extraordinary efforts everyone undertook at the beginning of the pandemic, and that includes insurers. I mean, we were meeting weekly and talking often daily, and the insurers, I think, really stepped up in this context, because this was, in March of 2020, this was uncharted territory, and we didn't really know what was facing us, but we knew we couldn't sit on our hands. We had to be proactive and try and really address issues as they came, but also try and anticipate issues. And I think the insurers did an excellent job. As Bill said too, the health industry, they were not bashful in contacting me. They had real concerns, and we tried to work together to come up with equitable solutions. And I think, at least in the short term, we were able to do that. So what happened with the pandemic? Believe it or not, the statute, the insurance code actually contemplates not so much a pandemic, but it contemplates something called an insurance emergency. When the governor proclaims an insurance emergency, it triggers pretty broad powers for me, which I tried to use judiciously. The governor had a proclamation of insurance emergency on March 12, 2020. And then I immediately, the same day, issued my emergency response order, followed by supplemental orders and bulletins. But really what we were trying to do, especially in the beginning, we were worried about four things. We're worried about access to care, access to coverage, and what happens if shortages were going on. Again, to step back, we were stepping into the unknown here, and we're really concerned about access to care. And one of the things I ordered under Maine law, telehealth, there's parity under, if a benefit is offered under your policy, there's a requirement for parity to be offered under telehealth, but what's not required is payment parity. And we were seeing the hospitals, the revenue literally fall off a cliff. And we needed to address that, I think, but also we needed to allow consumers access to healthcare. So actually, and it's continuing to this day, under my emergency powers, I ordered payment parity for telehealth. I think that in retrospect is one of the most critical decisions the Bureau made, because it allowed access to coverage during the pandemic when people were basically locked down. Vaccines and COVID screening and testing. I mean, I was very frustrated, I have to admit. I mean, the vaccines, the testing, at the beginning of the pandemic, people were having trouble accessing testing, and I found it very frustrating to have to argue over who's paying for testing. And I ended up ordering the insurers to pay for screening and testing without co-pays and cost shares. And again, there were frank discussions behind the scene, but at the end of the day, they stepped up and paid and did the right thing. And vaccines, the same, no cost shares. Again, we were making some of these decisions before the federal government made their decisions. Very important. And this is access to coverage. Bill touched on this briefly. Deferral of the grace periods and premiums. One of the things that he didn't mention that was critically important, I actually asked the insurers not only to defer premium to extend the grace period, but I did not allow them to pen claims. And what that means is I was requiring them to pay claims in the event, even if they didn't collect premiums. And that was an extraordinary ask on my part, but it was necessary, especially because I extended the extension of grace period to small employers, to the employer market. Now, if an employer doesn't pay his bill and during the grace period they get coverage, the employees would have no way of knowing that. And I did not think it would be equitable at the end of the day for an employee to get a huge bill that he or she had no idea they were occurring when they needed access to health insurance. And again, access to health insurance is critical during the pandemic. But again, we had frank discussions, and I extended it to June 1st. So that was from March, April, May to June 1st. And the carriers complied. And continuation of group coverage, employees subject to layoff at the employer's request. Again, it's usually when the employee is laid off, the coverage ceases. But again, it was all about access to coverage. And finally, in relative to shortages, we didn't know what was going to happen with networks, with drugs, and with providers. So we took the initiative. If the networks become inadequate, we're going to require carriers to pay network charges, even for out-of-network services, again, to make sure consumers can get access to care. Drug formularies the same. Again, at the beginning of the pandemic, we didn't know if there were going to be shortages of drugs. So we mandated substitutions in shortage situations. Again, so it's about access to care and provider credentialing. I remember very well my discussion with Katie. She was concerned about credentialing across the healthcare system. And again, it comes back to access to care. So we worked out a solution, and the carriers complied with it. And again, complied is probably too strong a word, but we worked together and we got access to coverage. But healthcare is not the only area where issues occurred. Property and casualty as well. There were several issues. Perhaps the most vexing issue is business interruption insurance. That continues to be a problem. Most insurers excluded it. That was after H1N1 several years ago, over 10 years ago. They started excluding it from their policy. So a lot of businesses were not happy to learn that pandemic losses were excluded. Unfortunately, insurance is ill-suited to covering pandemic situations. Insurance is best suited when a small number of losses are covered by a big pool risk. In this case, almost every consumer who had business interruption had a loss. And it really would have been a solvency issue if they were covered. I mean, nationally, the numbers I saw, the premium, the losses that would have had to been paid were $400 billion a month. Nationally, if they were required to cover business interruption insurance, and the entire surplus of the industry is $800 billion. But thankfully, there are some initiatives going on in Washington to try and duplicate TRIA, the Terrorism Risk Insurance Act, for future pandemics to provide coverage. And finally, I said most insurers excluded the coverage for business interruption. However, we were very firm on this. We told insurers they could not correct their language midterm. If they covered it, whether it was inadvertent or not, they had to live with the consequences and cover the losses. And we issued a bulletin mandating that. And finally, although I didn't have the authority to require rebating of laws, particularly auto insurance, when people stopped driving, fully 98% of insurers in Maine offered rebates. And the Bureau addressed anti-rebating regulations and took actions to enable these refunds to take place. But fully 98% of auto insurers provided refunds, health insurers did, dental insurers did. Again, the insurance industry, I think, really stepped up during the pandemic, and it continues to this day. And Peter, I'll stop there briefly to see if there's any questions before I head into a couple of initiatives I'd like to touch briefly on.
Eric, at this point, I don't have any questions in the chat box, so I would say go right ahead.
Okay, thank you, Peter. Right now in Washington, they've extended open enrollment for the individual market, which means people can apply to this day and get coverage on the individual market. And they've extended the subsidies for the individual market for those above 400%. And for the large group market, they have provide COBRA assistance. The small group market, in my opinion, and the governor's opinion, continues to be under significant duress in Maine. And we've tried several initiatives that are meant to help, and I want to discuss on two of them. One is the idea of merging the small group and individual markets. The idea for that is McGarrah, the Maine Guaranteed Access Reinsurance Program, provides reinsurance to the individual market. It's subsidized by a $4 per member per month assessment on the individual, small group, and large group market. And again, the small group market pays into McGarrah. And what it is, it's reinsurance for insurance companies. And in a small state like Maine with small risk pools, a few claims can drive the rate. So if you can have a mechanism to help cover those expensive claims, you can really have a dramatic effect on rates. Well, that's been in effect pre-ACA and post, I think, 2018 for the individual market. And we're looking, by merging the markets, we're looking at to expand the reinsurance by expanding the reinsurance program to apply to the small business market. Again, I have to do it in a public, transparent manner, and the decision I have until 2023 to decide to whether or not to merge the market. But the sole motivation about it is to provide relief to small employers who actually the market has gone from 90,000 pre-ACA to a little over 50,000 today. So it's dropped dramatically. And just to tell you the effect of McGarrah on the individual markets, the rates have either been flat or decreased. And last year, the rates decreased double digits in the individual market, not solely because of McGarrah, but certainly McGarrah was a big factor. So again, it can affect the rates. So we're looking at, is it feasible to merge the markets and introduce reinsurance to the small group market? And finally, there's I always get this acronym wrong, the American Rescue Act is provided funding to the states. The governor has decided that $39 million of that funding is going to go directly to relief for small employers beginning in July of 2021. What the design of the program is it's going to be much like the advanced premium tax credit subsidy for the individual market. It's going to be a subsidy that goes to the carriers, but it's going to be a direct flow through and a reduction of your bill. Right now, it's contemplated it's $50 per employee. And that's $600 a year for an employee. So for an employer of size 10, that's $6,000 a year. It's going to run 18 months. And we're also going to provide funding for dependents. We haven't figured out exactly what that level of funding is. We've got data requests out to carriers to try and determine that. So we're going to provide additional funding out of that $39 million to assist the premium subsidy for the dependents as well. One of the things we're going to ask is that those savings are shared with the employees at the employer level. We're going to directly reimburse carriers, and we're going to through the data call, and we're going to audit these the carriers at the end of the day to make sure every dollar goes to the employers in support of this program. I have no doubt it will, but I just think that's prudent when it's $39 million that I'm responsible for. But again, I'm very excited about both initiatives, but this one, we want to have it up and running by July. It's a tight time frame, but it's $39 million for a subsidy for small employers, running 18 months to December 31st, 2022. And again, it'll provide direct relief on your premium bills. With that, I'll stop there. I probably went over my 15 minutes, Peter.
No, that's fine, Eric. I do have a question, and since it's dealing with what you just discussed, I'm going to have you answer it. What is considered a small employer is the question.
1 to 50.
1 to 50.
And again, the small employer does not have to do anything to take advantage of the subsidy. If they have a policy in the fully insured market, if they're self-insured, it doesn't apply. But if it's a fully insured product, we're going to work directly with the carrier and make sure the savings flow directly to the employer in terms of reduced bill.
So Eric, I'll ask the question because you touched on it briefly. In the individual market, it's a subsidy, but what will be the expectations on the employer themselves when it comes to these subsidies or refunds or whatever?
Well, I mentioned we're going to have dependent coverage, and that's going to be an amount we have to we know the number of covered lives, but we don't know the breakdown. We determined it's $50 per employee, but we don't know the amount for dependent coverage. So that's the first step. So it'll be in addition to the $50. But what we're asking is most employees contribute to the payment of the premium. I don't know, 60-40, 70-30. I'm making numbers up, but there's some proportionality in paying for the premium, and we think that this subsidy should flow through to that granular level as well. Unfortunately, we don't have that breakdown. Insurers don't have that breakdown, so we're trying to determine. We're not contemplating going into employers and auditing. We're just trying to come up with a mechanism to communicate and say this is a requirement of this, to share the subsidy with the employees. That's a detail we're still working out though. But having said that, there is no requirement on employers. They get the subsidy by virtue of having an insurance product.
Okay. We can circle back to Eric after the other two speakers have had their chance to deliver their message. If you have questions, like I said, do put them in the chat box. So next, obviously, the healthcare systems and healthcare providers played a huge role in combating the pandemic and protecting the health of our citizens. Katie, why don't you tell us a little bit about from Maine Health's perspective?
Thanks, Peter. Thanks, Peter, and many thanks to the Chamber for putting this together today. I am very proud to be a Mainer, actually. When I think about the role that we played, it's really in conjunction with all of you. And that is from the Chamber to the governor and her team, who did a phenomenal job. Eric noted a number of the provisions that he worked on to support patients, because it really is all about the residents of Maine and our patients, as well as DHHS and the incredible work that they did in trying to navigate this system. And our partners who are our employer partners, the carriers, and the brokers all work together, I think. And that Maine is one small town in some respects, and that really proved to be very, very important during the pandemic. And I'd say that was particularly important here because we do not have strong public health infrastructure. So it was the hospitals and the healthcare systems that stepped forward and provided the public health effort that really addressed the pandemic. And we did so. I'm going to talk a little bit about what worked and what didn't work, some of the challenges that we had in relation to the specific pieces of COVID. So testing was, when we started this March, I think around March 8th or 9th last year, Nordex had stepped up and they actually had a test. They were one of very few in the country that had identified and put together a test that actually worked for COVID. So that proved to be incredibly important to Maine's success, where we were challenged because testing supplies and tests were going to those hotspot areas such as New York City early on. So Nordex worked collaboratively within our system and our federal delegation to ensure that they had the supplies that they needed to run the tests. And that proved to be really important part of our whole strategy in Maine to prevent this virus from becoming a major problem here. And in fact, it worked. Nordex was not alone. Northern Light also developed testing capacity. As we went along, testing capacity became far more ubiquitous, but Nordex was early on in the pandemic, was able to step up and provide that. And I really, a shout out to Senator Collins and Senator King, who worked very closely with the federal government to ensure that we were able to access some of those supplies that were going to other locations. So that was important. I think the second piece I would talk about is really around the treatment side. We provided treatment not just for individuals with COVID-19, and Maine Med alone provided treatment to about 45% of the individuals who are hospitalized with COVID. But we also, to Bill Whitmore's point earlier, provided a lot of treatment through behavioral health. We have Maine Behavioral Health Care, which is integrated into our system. I'll talk a little bit more about that in a little while. But the telehealth, our ability to pivot to telehealth was critical. We have provided over 200,000 telehealth visits today. We were doing a handful of visits prior to the pandemic. And included in telehealth is audio. And I want to emphasize that because particularly in our state where Wi-Fi is not very accessible, audio, telephone visits have been absolutely critically important. But let me step back for a second and talk a little bit more about the treatment. The good news was that Maine Medical Center had opened, thanks to the support of our communities, had opened a unit of universal beds, brand new universal beds that were actually going to be in the new oncology wing, that we were able to flip because they're universal. They were able to become a COVID unit and to serve as an isolated unit for patients with COVID. That proved to be really, really important part of our treatment strategy and our isolation strategy to keep COVID from spreading within the hospital. We also, Midcoast, we had COVID patients throughout our system. Southern Maine Healthcare, Midcoast, and Maine Med were by far the largest providers, but Maine Med had those individuals who had the highest level of acuity throughout the pandemic, and that continues today. In addition to providing the inpatient care, as was mentioned earlier, we also emptied out all of our other services for a period of time with huge financial implications to that. By the time the pandemic is over, we will have lost about $100 million net, and that's net of the federal support that we have received. So it came at great cost, but we made sure we were able to step up and take care of our care team members, recognizing that we would need them going forward. So we continued to pay them, even those who were not working at the time, who went home. We were challenged in providing the support for those care team members who were able to work at home, but for whom we had not set up home offices yet. So we ordered one day like 2,200 laptops to get out to our care team members. All of that came at a pretty significant cost, and I would say we were building the plane and flying it at the same time around all of these efforts. And at the same time, the federal government kept coming out with new waivers, which were helpful in many cases, not always as clear as they needed to be, but working between the federal government's waivers that allowed us the flexibility to serve patients differently, and at the same time trying to work with licensing at the state, proved to be a bit one of those challenges that we faced. The state did its very best to work with us, but we have nursing homes, for example, as part of our healthcare system. They're critical in terms of being able to discharge patients who have been inpatient in the hospital and can't go home, and working through some of the machinations related to different licensing and regulatory requirements for hospitals versus nursing homes actually continues to be one of our challenges today, although it has gotten much, much better. Other things that worked for us, allowing our patients to have no cost sharing. That made a huge difference in terms of bringing patients in the door earlier and ensuring that they were able to get the care that they needed early on without fear of having to have out-of-pocket costs that they couldn't afford, and particularly during challenging economic times. And a huge shout out to the state for having passed Medicaid expansion. That made a tremendous difference, particularly for our rural communities where we have high numbers of patients who are on Medicaid. That provided them with a comfort level and provided us with support, financial support for treatment. In terms of telehealth, I think we're, in addition to sort of building the plane and flying it and teaching our providers how to do telehealth at the same time they were doing telehealth, we found that behavioral health is the piece that's going to stay. There's no question about it. It's been very successful for many of our patients, but that payment parity that Eric mentioned earlier is particularly important because with telehealth, we still have to maintain the infrastructure of offices. They're not going away. We still have the need to have office-based services. So I think that's going to be a conversation for the future as we think about challenges ahead. Finally, as we sort of ramped up and got treatment back underway, we've actually been challenged with having a large level of need within our hospitals, and that pent-up demand from people that was mentioned earlier, and ensuring that we're able to meet that demand within the current regulatory and the regulatory environment and just the safety environment that we're working under. But we are working very hard to get people in for their screenings and ensure that our care team members have been incredible at trying to ensure that their patients' needs are met. On the vaccine front, it has been one of the proudest moments that I've had working in healthcare in my career. Watching the community come together to support the mass vaccine clinics across our state has made all the difference in bringing us to a level where we're 70% of our residents are now vaccinated. That was absolutely amazing. Volunteers, employers stepping up and paying their employees to go work in vaccine clinics so that we could ensure that our public was safe and that we were able to get our residents vaccinated made a tremendous difference. And I'm sorry to see Scarborough Downs close in some respects. If anybody got to visit that site, it was a particularly powerful moment when you walked in and saw the happiness that was there. It was a really nice way to sort of frame the other end of the pandemic, and our partners really stepped forward and made that possible, as well as our care team members. So now we're starting to move back, and I think the pieces that, as we think about the challenges going forward, they're really going to be in the areas of ensuring that we're able to maintain telehealth, maintain some of the things that have worked well at a time when our care team members are exhausted. And the workforce challenges that we have in the state, they're endemic within the healthcare world, as well as the rest of the employer world. And I worry very much, particularly in the areas such as nursing, that we're going to see, we're going to be continuously challenged with people who are dropping out of that field because of the exhaustion that they feel, because of the challenges that they've faced over the last year. I didn't mention PPE, but that was clearly a major challenge going at the beginning of the pandemic, with the federal government not having any supplies available for us to take care of our care team members, to make them feel safe, because we know that that's the single most important thing that we can do. So I guess to wrap up, what worked is Maine came together as a community, and we provided that public health infrastructure together that had allowed us to have low levels of COVID and to treat our patients with exceptional care, and then to vaccinate our patients, though we're not done with that yet. We had past Medicaid expansion that made a tremendous difference, and the commitment of our care team members cannot be underestimated. Thanking them every single day for their frontline work of taking care of very, very challenging cases. And I think our challenges going forward are going to be both financial and corresponding to the financial, the workforce challenges that we face as we try to ensure that we're able to maintain one of the most exceptional healthcare systems in the country. Leapfrog just gave all 5 of our eligible hospitals A's. And that speaks volumes for the high quality care, and it's across Maine's hospital system. It's not specific to Maine Health. So with that, I'd be happy to answer questions, and I'll turn it back to you, Peter.
Thank you, Katie. Eric German, you worked as a producer with employers throughout this pandemic, and you probably heard from them firsthand their concerns. Tell us what your experience was from your world's perspective.
Yeah, well, first of all, Peter, thank you to you and the Chamber for hosting this event. But in addition, thank you to the Chamber for your leadership over the last 15 months. Between social unrest and diversity, equity, and inclusion issues, and the business issues that we face as a result of this pandemic, the Chamber really took a leadership position that was really important. And I'm going to add to the list of thank yous. Katie mentioned that it felt like we were building the plane while we were flying it. Well, at times it felt like we were sewing the parachute. So this was an incredibly challenging year, or really 15 months. And I'm going to reiterate what Bill said. Eric and his team at the Bureau were an incredibly responsive. Eric and I had many cell phone calls and emails exchanged as we were trying to figure out exactly what this was all going to mean to our employers. And Eric and his team gave the impression of being really level-headed and very calm. But I'm going to guess that it was more like a duck, that on the surface they were calm and collected, but underneath their legs were churning, is my guess. I also want to thank the Department of Economic and Community Development, the DHS, also the carriers. We were dealing with completely uncharted waters. And while we didn't always agree with approach, we all agreed to calm and collected conversation and debate. And I think in the end, it really worked out. And then, of course, Maine Health and all of the other providers in the state. If you watched the process and weren't incredibly impressed with the outcomes, I actually want to thank Maine General in particular. That's where I got vaccinated, at the Augusta Civic Center, and the process was incredible. Very, very smooth. And the last thank you I'm going to give, and many of them are on this call, is to my own team. I can't possibly say enough. We went March 11th. We started thinking about moving our team to remote, and March 17th, we were fully remote. If you had told me that we would do that in a period of 5 days, and by the way, 2 of those days were a Saturday and Sunday, if you had told me we'd get that done in 5 days, I would have told you not a chance. And it couldn't have been done without my team's flexibility and resilience. So thank you. So yeah, Peter, I'm going to talk about this more from the employer perspective. Right out of the gate, employers were just starving, absolutely starving for information. And the problem was we didn't always have answers. So there were questions about compliance issues, how to move your workforce remote, or in the case of, let's say, manufacturing. I think of Volk Packaging, Derek Volk, and what he did down at his facility. You can't make boxes remotely. They had to be in the facility, yet Derek and his team managed the process incredibly well. And I don't think they had their first positive test until after the first of the year, which is just remarkable given the size of their workforce. Employers were also incredibly worried about maintaining coverage for their employees. That was, Eric mentioned it earlier. We're in the midst of a pandemic. Maintaining coverage was essential. And our employers were not worried necessarily. Of course, they were worried about paying premiums, but first and foremost, they were worried about maintaining coverage for their employees. Also worried about COVID testing and treatment costs. Were they going to be covered? Weren't they going to be covered? How were they going to be covered? Then, of course, when premium forgiveness was introduced, what did that exactly mean? And this is where Eric and his team really took a leadership role and jumped in to define exactly what they intended with premium forgiveness. And then, of course, COBRA impacts and whatnot. The need for information was drastic. Lots of questions from both employees and employers. HR teams were absolutely overwhelmed, and it's just been a real this vacuum of information. So what we did early on, and I'm going to specifically call out an individual, Betsy Glanville. Betsy and I actually worked together at Anthem, and she was kind enough to come over and join us here at Cross. We put together a document early on, a resource for our employer groups. And to say the resource grew is an understatement. Ultimately, it was well over 200, I think actually over 250 pages long. And I actually got to know some people through sending these things out on a weekly basis at first. Then we kind of, as the need changed, we decreased the frequency because it was a pretty large document. But that document covered, it was not specific to health insurance or employee benefits issues. It really spanned, because the questions we were getting were not limited specifically to employer benefits. So we were talking about PPP loans. We had all kinds of different information in there. Then when ARPA, the American Recovery Plan Act, was passed back in March, the questions just tripled overnight. We very quickly partnered with Bernstein Shore, our legal partner, to offer a webinar. And if the attendance at this webinar, we had over 600 attendees at this webinar. So if that doesn't tell you what folks were starving for information, I don't know what would. And now the webinar happened 10 days after the law was passed. So honestly, we had a lot of answers which were, we don't know yet. So we ultimately put together a document based on the 74 unanswered questions that came out of that webinar. We put together a follow-up document, then ultimately had a follow-up webinar that was coordinated by Jeffrey Weatherhold, who is our Director of Compliance, and to say Jeffrey's been busy during this this whole pandemic and ARPA and you name it. It's been really, really challenging, and she's been fantastic. So what are employers asking about now? They're asking about vaccinations. What about mandatory vaccinations, incentives for vaccinations, and any associated HR policies? What about a long-term remote workforce? What do I need to worry about with my long-term workforce or a hybrid workforce? You know, so if we go that route, what are the impacts going to be on the mental health of my team? I can tell you, we were joking about this as we were preparing for the for this webinar, but it's hard to read body language, and it's really hard to see how your employees are handling this thing while you're looking at them at a little screen. And so as we contemplate long-term remote workforce, how do we manage their mental health? How do we manage a team atmosphere? How do we maintain that sense of team unity when people are remote? What about impacts on morale issues? Impacts on team engagement? We know many of our employers are now looking for technological solutions for team engagement as it relates to a remote workforce, and we've got several solutions there. But it's been, and then Katie and everyone else has talked about telemedicine. Well, what's ultimately going to be the long-term impact of telemedicine? We're going to have greater availability. What about more increased use in the area of mental health? I can tell you that folks in my family have made use of mental health services through their iPhone, and it has been incredibly helpful. Well, and what other opportunities exist in the area of telemedicine and as Katie mentioned, audio medicine, because that is absolutely essential, especially in a rural state like Maine. People, or another issue is scheduling processes. I can tell you the healthcare systems have gotten really good at scheduling, just simply as a result of this pandemic. I'm going to guess that they're going to maintain those processes. Another issue actually related to remote workforce, recruiting. So now you've got employers based in Maine saying, hey, wait a minute, if we're going to be remote, we don't need to limit our recruitment to New England or to the Northeast. We can recruit anywhere. So how do we do that? And how do we do it successfully? Also, medical claims. At the end of the day, cost is still going to always be the #1 issue related to health insurance. So what are the impacts of technology going to be on healthcare claims? Bill mentioned that we are already starting to see the bubble that we all have expected from care that has been pushed off. We're starting to see that. What's that going to mean? We're also heading into likely an inflationary economy. Well, inflation is going to hit all aspects of the economy should it arise. It will especially hit in the area of healthcare. We all know that healthcare inflation trend tends to triple typical inflation. What will that impact be? If we're looking at inflation rates of 3, 4, 5, 6%, what will that mean in the area of medical claim spend? So those are some of the issues that are really of concern to employer groups. Also, folks are looking at concierge level service. What can we do to better assist our employees in accessing the system, and also to positively impact outcomes and costs. Ultimately, though, and going back to the mental health issue, wellness. I think largely employers have often thought of wellness as an in-office or in-facility solution. And if we're going to move to a remote workforce, we've got to find technological solutions to, and they're out there. There are many. We have a partner by the name of Restore Resilience that we work with that offers a fantastic coaching-based technology solution. that really can outreach to the remote workforce. But at the end of the day, the bottom line, as it always is, when it comes to health insurance, is cost. And that's the ultimate concern of our employer groups. They are looking at creative solutions, whether that be moving to a self-funded solution, captive reinsurance arrangements, reference-based pricing solutions, or non-group solutions. Eric talked earlier about the individual and small group market. We now have large groups that are now considering individual coverage HRA solutions that basically take the employer out of the group market and move those employees into the individual market. We have several groups that have made that change. So there's a lot to consider at the employer level, and the term uncharted waters was used. I think we should have had a bingo card set up at the beginning of this this call where we could have uncharted waters, telemedicine. We could have had a lot of phrases that we would put in there, and we could have had a really interesting bingo game. But at the end of the day, I've been absolutely amazed at how resilient our employer groups have been and their employees. And again, thank you to all those folks that I mentioned earlier. It's been, if you had told me a year ago we would come out of this the way we have, I'd have taken that. I'd have said, great, sign me up. So with that, Peter, I think we're going to go to questions.
We are. We don't have a lot of questions, but I actually have one for each of you. And it's the same question, so you can all take a shot at it. Obviously, a lot has happened in this state with regard to the progress we've made getting people vaccinated. In particular, I read this morning that I believe we have the second highest level of our population vaccinated that is currently eligible in the country, which is fabulous. Over 70% of eligible people have had at least their first shot, and we're closing on 60% for the second shot. The guidelines have changed. Masking isn't necessarily required. Social distancing isn't required. For the first time, I think people are looking over the horizon and they're seeing a sense of normalcy and hopefulness, particularly as we enter the summer, which is super important. But on a going forward basis, there's going to be a legacy of challenges as a result of the pandemic, and that's not going to go away. We talked about how the fact that, one of them is going to be Zoom. Zoom isn't going to go away. We're all going to have some kind of Zoom meetings as we march forward. But in each of your worlds, real quickly, what would you say you think will be the greatest challenge for you that you're aware of today, that you could put into context today for each of your industries? And Katie, I'll start with you.
Okay, thanks. I think that the biggest challenge for us is really the workforce shortage that we're facing today. I'm going to say there are two challenges. I think that is absolutely front and center, and the challenge, of course, that's exacerbated by the fact that Eric's point around cost. We're not seeing payment rates increase at a rate that will sustain the demand for our workers. So when our workforce can go work at McDonald's and get paid more than they can doing some pretty challenging jobs at the hospital, we face a really tough balance. McDonald's can raise its prices. We don't have that same capability in the same way. So I think that's going to present a massive challenge. And I cannot understate the challenges related to behavioral health. I believe this really illustrated the gaps that we have in the system. And we have so many people now who are experiencing mental health and substance use issues as a result of the pandemic. And we simply do not have the infrastructure in Maine to support their needs. And so that, I believe, is going to be the other piece of the pie, nor do we have a payment structure that supports it. It's just been built differently than the rest of the healthcare system. And we've got some challenges going forward around integrating behavioral health into our regular service delivery system and ensuring that we sustain that going forward.
Eric German, how about you?
So I'm going to answer this from, I think, two different perspectives. First, from the perspective of our employer groups, which is cost. I think anybody with business acumen can put themselves in the shoes of the provider community. There is a great deal of unknown in terms of what the long-term impacts are going to be of COVID-19. And ultimately, it will likely lead to increased costs. And then when the provider costs increase, that then leads to increased premiums. So that is absolutely far and away the number one concern of employer groups. On a more societal basis, I have real concerns about the long-term mental health and substance abuse impacts of COVID and the impacts of folks being cooped up in their homes and the changes in behaviors that they've seen. We've all seen, you watch the news, the rate of overdoses has really exploded. We have got to, as a state and a country, we have got to get our arms around opioid addiction. We have to. The long-term implications are dire.
Bill, how about you from the carrier perspective?
So it's really striking to me, and I'm sure it is to everybody who's listening, how much we talked about behavioral health over the past hour, and then over the past 3 minutes with Katie and Eric. That's certainly an issue. The workforce issue. I was in a meeting with an employer yesterday, and they talked about the capacity for behavioral health services is not there. You might see a list of 500 providers in Portland, and it might be the 100th that you call before you actually are able to get an appointment. So that's a big issue, and I think it's a takeaway for all of us that we're all talking about it so much. And we were talking about it before the pandemic. We've clearly been talking a lot about it since the pandemic, because things are certainly worse, and we're going to be talking about it going forward. I mean, you just think about simple things like transitioning back to offices, which was mentioned. I think a lot are starting. Some have been there for a while. This September looks like a big kind of line in the sand where a lot of people will go back after Labor Day. And that's going to be an issue for people. Transitioning out of the office was sudden. It was required. You had to. Now there's this, do you go back? Do you not go back? That's going to cause some real issues for people, along with everything else. Cost obviously is an issue. We talk about that all the time. It's what is it, close to 20% of GDP now. It's not a simple thing to address, but we have to keep talking about it. And access to health care and benefits. Really, if you want to frame it up in health equity, that's something we're going to be dealing with too. And we're trying to pay a lot of attention at Harvard Pilgrim to that issue to make sure that access to health care and access to health insurance benefits is consistent across different populations. I think that's going to be an issue too. I think that's enough. I'll pass it on to Eric Chopper.
Mr. Superintendent, I'll let you have the last word, but it's no fair. You can't use the legislature as the greatest challenge. That's mine.
I'll leave that to you, Peter, but as you well know, I could. Costs, and when we're talking about health insurance in particular, costs, and I'm with, all of us have discussed costs. Insurance will reflect the underlying costs, and I don't see any solutions on the horizon. And no one wearing a black hat or white hat in this environment. I mean, I know from personal experience, some member of my family had a treatment that was $800,000. How do you deal with costs like that in the system? And until we come to come to grips with how we're going to deal with costs, health insurance is going to continue to become more and more unaffordable. And we desperately need to address that. The other issue is access to coverage, whether you're talking business interruption or health insurance. You know, what's that saying? Never let a good crisis go unused. I mean, we really need to step back. What worked, what didn't work, because unfortunately, this is probably not a one-off. We need to, like Bill said, you know, people losing their coverage, their health insurance coverage during a pandemic is the last place we want to be. Business interruption insurance, I mean, they were closed down and it was tremendous burden on employers. So I think we need to determine prepare for the next pandemic or the next global catastrophe, because it will come, and they'll probably come quicker than we hope for. So I think that's it. And final comment is I was remiss in not mentioning brokers and Eric in particular. I learned that I don't know everything, and I reached out and people reached out to me so we could make better decisions at the Bureau. And the feedback I got from whether Katie, Bill, or Eric was invaluable, just to name a few, and as we try to navigate this COVID-19 crisis.
Well, I want to thank you all, Katie, Bill, Eric, and Mr. Superintendent, for joining us this morning. Before we finish, we're pleased to have with us this morning Denise Mcdonough, who's the president of Anthem Blue Cross and Blue Shield in Maine, and they are a principal sponsor of our program today. And Denise has some closing thoughts for us. Denise?
Great, thanks, Peter. And thank you to the Chamber for organizing yet another terrific forum. I would echo Eric's comments in thanking the Chamber, the Superintendent, Katie, and Maine Health for the amazing work that you have all done during this incredibly challenging crisis. It's been incredible to see and be a part of so many disparate parties coming together to quickly make such a positive and a profound impact on Mainers here. You know, the COVID-19 pandemic has been such a rare experience in all of our lifetimes, one that's created profound, pervasive, and very lasting health and financial and social impacts. But it's also delivered many learnings. It has shown that the impacts of disease are not the same on everyone, that healthcare players can be more agile in the face of rapidly evolving situations, and that there are better ways for payers and providers to safely deliver care, improve access, and address health inequities. So, you know, 1+ year into the pandemic has given healthcare players like Anthem data, and it is certainly something that we're closely evaluating within Anthem, and I'm sure at all carriers. We'll be assessing the long-term impacts of the pandemic and identifying trends and opportunities for change and improvement as we move forward together. One thing is true that we've seen over the last year, and that is by combining technology with expertise and compassion, we can truly redefine the future of care to improve lives and the health of our communities. So thanks again for today's discussion. It was wonderful to see some of your faces, and I look forward to continuing to work with all of you on these issues. Thanks very much, Peter.
Thank you, Denise. And again, I want to thank all of you. You know, as much time as we've spent in front of our laptops or desktops, cameras on Zoom, people start to get, and we joke about it, that Zoom fade. But we've had a great attendance today. Almost everybody who signed up joined us to listen in. I hope you found the program helpful and interesting. I know I did. I do want to thank our premier sponsor today, Harvard Pilgrim Healthcare, and our principal sponsor, Anthem Blue Cross Blue Shield in Maine. I want to thank our other sponsors, Cross Insurance Company, Central Maine Healthcare, Maine Health, AmeriHealth, Maine Primary Care Association, Martins Point Healthcare, Northern Light Health, and the University of New England. All of you for your support in this around this important issue and around this forum. It's been our pleasure to bring it to you today. I wish you all happiness and health, and to enjoy this Memorial Day weekend in a way that we could not do it a year ago at this time. So thank you all, and be safe.